Immunosuppressant drugs. The immune system defends the body against invading pathogens, foreign antigens, and its own cells that sometimes become cancerous. The immune system can also sometimes attack itself, causing autoimmune diseases or immune-mediated diseases. The immune system participates in the anaphylactic reactions, and it's responsible for the rejection of organ transplants. Immunosuppressants are drugs that decrease or prevent an immune response, thus suppressing the immune system. They stop the immune response. They stop the body from rejecting an organ. Because these drugs immunosuppress, the patients are then immunocompromised. They're at risk for getting infections. Big press with these drugs. We need to be watching for these infections, helping people not get these extra infections. All immunosuppressed patients have a heightened susceptibility to opportunistic infections. Stuff that you and I, having a normal immune system, wouldn't be susceptible to. These people are. Here's a list of a lot of the different immunosuppressants. You don't need to know them all. Please do know that corticosteroids do play a part in suppressing the immune system. And we're going to focus on two of these particular drugs, immunosuppressants, a little bit later. The indication for immunosuppressants varies from drug to drug. What it's used for depends on the specific drug. Primarily we use them to prevent organ rejection, although sometimes we also use them for the autoimmune disease, such as rheumatoid arthritis and multiple sclerosis. We use these drugs so that the recipient and their immune system don't recognize this new organ, this transplanted organ, as a foreigner, and thereby the immune system isn't triggered into action to reject it. Imuran, azathioprine, is one of the drugs we use, and it's primarily used to prevent the rejection of kidney transplants. However, it's also used in the treatment of rheumatoid arthritis. Similarly, cyclosporins are used to prevent organ rejection, and we're using them for kidney, liver, heart, and bone marrow transplants. And it can also be used for treating autoimmune disorders. Now, as we look at the list of things to assess for, think about this. Some of these have to do with immune system response. Some of these have to do with infections. These people are at risk for infections, so we need to be checking them for all the signs and symptoms and laboratory values that go along with infections. We're assessing for contraindications, obviously, allergies, interactions. We're looking at the white blood cell counts throughout the therapy. If the count drops below 3,000 millimeters cubed, the drug should be discontinued. But we can't do that. You need to contact the doctor first and say, hey, look at this white blood cell count. Do you think we need to stop the drug? Immunosuppressants should be taken with food to minimize GI upsets. The oral forms are used when possible to decrease the risk of infections that can can occur from parenteral injections. Parenteral injections, we're sticking a needle right into the core vascular system of the human body. That's a great pathway for infections in an immunocompromised patient. We don't want to put them at risk for a systemic infection. There are several possible drug allergies. Grapefruit juice interacts with some of these drugs. Oral fungal drugs are usually given as well. Remember, opportunistic infection, that's Candida, and we can see a lot of thrush. So we're going to be checking for thrush with these people. Oral cyclosporin should be given in mixed in a glass container, and when we go to give it, don't give it in a styrofoam cup because the drug's going to adhere to the styrofoam cup. People need to know that they're going to be taking these drugs the rest of their lives, because as soon as they stop taking it, the body's going to recognize that transplanted organ as a foreigner and reject it. So people are take these drugs forever. Basic infection control. If they're taking these drugs, we need to help them figure out how to minimize their risk of getting an infection. Avoid crowds. Avoid people who are sick. You got any sign of being sick at all, you let somebody know immediately. And as always, we're monitoring for therapeutic responses and adverse effects.